everybody. I'm Jessica with BCID.
How you doing? My name is Jose Hernandez with United Spinal Association. Today we have a great presentation on pain management with two very established individuals in the industry, including Dr. Bryce, who has many, many years of experience in pain management, and Ethan Ruby, who will introduce himself and has a lot of knowledge when it comes to alternative medicines.
You, my dear, have jumped the gun. He forgot to mention that if you have any, sorry, my birds, if you have any questions, go ahead and put them in the Q&A or in the chat box, and we will answer them, or Dr. Bryce or Ethan will answer them.
So we do have Otter AI. I'm going to put a link into the chat feature, and we also have live transcription if you need closed captioning by clicking the closed captioning button. So without further ado, please, Dr. Bryce, introduce yourself and give us all your vast knowledge.
Okay. Hello, I'm Thomas Bryce. I work at Mount Sinai, a rehabilitation physician, a physiatrist. And I've been here, I guess, 23 years now. And I will just give a kind of an overview of, kind of the conventional approach to treating pain after spinal cord injury. It'll be rather condensed, but we can get started. And share my screen. I don't have any disclosures to make. I have no financial interest in any of the medications or any treatments or anything that will be discussed. So pain after spinal cord injury is super common. 8 out of 10 people have ongoing pain, and this is for people who've been injured 20 years as well as people who've just injured 1 year. So it's very common. And of that pain, 5 out of the 10 people who have it, this pain is severe enough that it interferes with activities of daily living, including work. So the two most common types of pain after spinal cord injury that we see is one is neuropathic pain, and the second is musculoskeletal pain. But most people after spinal cord injury, if they have pain that's persistent, have more than one pain. And if we look at a large group of people, usually people have at least 2 pains. They may have like a shoulder pain, which is a musculoskeletal pain, and also a neuropathic pain, for instance. Now, why do we have pain after spinal cord injury? To understand that, you just have to kind of know a little bit about the nervous system. So we have nerves, which are neurons, which are the wires that connect all our organs in our brain. So it's the wiring that takes the signal. If we injure our finger, the signal that something was wrong, travels up the nerves in the arm, and then it goes into the spinal cord and up to the brain. So damage there, causes, and basically these, what we have is electrical signals, and they're called action potentials that are traveling up. So basically everything we do, is caused by the electrical signal traveling along these wires or these neurons all the way up to the brain in terms of, sensation and pain. And there's different wires or different roadways for all the different sensations. So if we touch something, there's a signal that goes up one road, all the way to the brain, versus if we, have a pinprick, that travels up a different pathway. So like, for example, if we're driving from Washington, D.C. to New York, there's a couple different roads you could get there. And it's like these different signals travel up different roads. And there's different roads for touch sensation, pinprick sensation, cold sensation, hot sensation, pressure sensation. They all take different pathways. In neuropathic pain is related to spinal cord injury, is caused by damage to the spinal cord, which causes these injured neurons in the spinal cord. So here's a picture of the spinal cord kind of in cross section here. And the nerves here, because they're damaged, they start firing off on their own. So if we put like an electrode there to kind of measure those action potentials, we see instead of like the signals only going when we're touching someone, they can just kind of go all the time. So we have this abnormal firing, which can be quite quick. And if this abnormal firing continues by itself for a long period of time, the spinal cord and the brain, they can change. And you can have this abnormal firing in the brain too. So even though the injury is to the spinal cord originally, because this keeps firing off and send the signals to the brain is what we call plastic. It makes changes and it has this abnormal firing too. So if someone has pain for a long period of time and we would put electrode in their brain, we see that there's abnormal firing there as well. And this is, one of the reasons why it's, very difficult to change pain when someone's had it for a long period of time. And as we just said, the different neuronal pathways, they carry different sensations and different types of pain. If, for example, the nerves which carry the signal for heat pain are altered by the spinal cord injury, and then these neurons and that start firing very fast for their own reason, that could be a reason why that person who has this burn and pain in an area where they can't feel feels this area is burning and hot, and it's they feel that their leg is burning or their whole body is burning. And even though it's not hot or burning, they feel it because those nerves are, firing off on their own. And where someone feels pain after spinal cord injury depends upon where their injury is. So in neuropathic pain, can occur where someone doesn't feel as well. So for example, if someone has an injury in their neck at that C4 level, which is up here, they may feel this neuropathic pain in their arms, their chest, their legs, their genitals, everywhere below the injury. Or they may also just feel it kind of up in their shoulders or in their upper back. So it can be either at that level or it can there, or they may just feel it right around their bottom or their anus or something like that. So it can be very variable. If someone has an injury at T8, for example, in the middle of the back and the spine, they may feel pain going right around their spine, like a tight band or like a snake being squeezed, or they may feel it in their legs, anywhere below. And it could be the whole area below where their injury is. So how do we treat it? So conventionally, there's a whole bunch of different things that we try. And you can see here all the different types of things that we have. So we have oral and topical medications. There's relaxation therapy and psychotherapy, which is kind of thinking type therapy. There's various different stimulation therapies and passive exercise. There's active exercise and physiotherapy. There are various surgical interventions that have been done over the years. And there's also procedural interventions like sticking needles into the body as well. We'll just briefly kind of review a couple of these different things. And we'll start with oral medications because this is, what most people use and where we have the best evidence in terms of these treatments being evaluated scientifically. And of the medications, the group of drugs called gabapentinoids, of which there are two, gabapentin, also called Neurontin, and pregabalin, which is also called Lyrica. This is the two drugs that have been shown to have the best evidence in scientific trials. So you give a medicine to people or you give them a placebo, which is like kind of a sugar pill. And so that the person who's getting the treatment in the trial doesn't know which they're getting. And the people who are evaluating whether or not the pain gets better or worse are not knowing which person gets. And in these large clinical trials, they found that these are the ones that help the best. And granted, they aren't working perfectly, but it is the best evidence that we have. And how they work is they limit the high frequency repetitive firing of the action potentials. Remember I showed you that action potential in the early pictures? and they bind these channels in the neurons. So basically what they do, that's kind of a fancy way of saying, is they interrupt that high frequency firing, you know, that spontaneous activation of those action potentials that we saw after an injury. The one good thing about it is they generally don't interfere with other medications and are generally well tolerated, although sometimes people get some feet swelling or become sleepy from them. Also in the first line, you know, it also has good evidence for in clinical trials, but a little bit less strong than that other group, and they also have some more side effects, are the tricyclic antidepressants. So we have nortriptyline, which is also sometimes called Pamelor, or amitriptyline Elavil. And these can sometimes cause some sleepiness, so they're oftentimes best given at bedtime. And they can also sometimes, when someone is old, affect their heart rhythm and also cause constipation. So they're generally not the first thing that we start, but they work a little bit differently than the gabapentinoids. So oftentimes we will add them on, especially if someone is having difficulty with the pain at night. Second line, so there's even less evidence for these things in clinical trials, are the SSNRIs, which are a type of antidepressants, but they're also approved by the Food and Drug Administration for neuropathic pain. One example there is duloxetine or Cymbalta. And they can also, because they're also in the antidepressant class, can also help with mood and anxiety in addition to the pain. Well, their main side effect is nausea, which some people have as well. But all these drugs, the SSNRIs, the gabapentins, and the tricyclic antidepressants, they all work a little bit differently. So sometimes we combine them to kind of get more effect. Other types of medications we use are other anti-seizure medicines. One is called oxcarbazepine or Trileptal, and lamotrigine or Lamictal. These are other drugs that kind of help depress that abnormal firing where there's the injury. Of the opioids, tramadol has really been the only opioid which has been shown to be helpful for pain after spinal cord injury in specific, but it's certainly less evidence for this than the other medications I mentioned earlier. And of course, as you know, they can be especially dangerous because they cause addiction and constipation and depressed breathing and impair sex drive. And if you mix with other medications which are also can cause that depression in terms of affecting your respiration, for example, with like benzodiazepines for Valium, they can also lead to respiratory slowing. And if someone doesn't have strong breathing, can make it so you stop breathing. So, and that's why people die of overdoses, because they stop breathing from this. Next, we can move on to relaxation and psychotherapy. And probably the main kind, and what we find works the best, is what's called cognitive behavioral therapy. And this seems to work by helping people, change their behaviors and how they think about pain, and how they can best manage the pain. So, and this has been shown to decrease how much the pain interferes with someone's life and improves their abilities to participate in their work and other activities, but has not really been shown to decrease the pain severity. So people are more active and able to do things using this treatment, but it may not necessarily decrease the intensity of that pain. Exercise, aerobic exercise, if you do that regularly, at a moderate intensity, this has been shown to reduce both neuropathic and musculoskeletal pain. So everybody who can is, encouraged to do aerobic exercise, almost every day, because that can help a lot. It doesn't have a lot of side effects as well. Other passive and stimulation therapy, so massage, stretching, position adjustment, to make sure you're positioned well in your wheelchair and other types of things, or electrical stimulation, TENS. All these things are generally more effective for the musculoskeletal pains, as you might imagine. There's another treatment which is relatively popular these days called repetitive transcutaneous direct current stimulation, where this is where you wear a kind of a special cap and it's hooked up to a little machine, and a couple times a day you wear that. And that sometimes helps people with pain after spinal cord injury, although the results are mixed. It helps some people and not help other people. Other procedural and surgical interventions, spinal cord stimulator. So these are a stimulator which is implanted into the spine next to the spinal cord. It hasn't really been shown to be effective for people who have, complete injuries. They don't have great feeling below their level of injury. It may help in people who have very incomplete injuries who don't have much sensory deficits. But overall, it doesn't really have great effectiveness. Acupuncture, may be helpful, but generally more effective for musculoskeletal pain. There's not a lot of evidence that it helps for neuropathic pain. So in summary, there's a few, actually only 3 treatment approach principles. So one is we try and combine pharmacological treatments that work a little bit differently, so each may help a little bit. So for example, someone may be on the pregabalin and the duloxetine, because they both work a little bit differently, and that may help decrease the pain. And as we talk about here, and you may want to give one of the medicines that can help with sleep, or if someone is not having trouble with sleep, then you wouldn't necessarily add that. Someone's also a little bit depressed mood, then you may want to add on the SSNRI, like the duloxetine. So it depends upon what other symptoms are there in terms of what medications you choose. The second principle is to combine different class treatments. So for example, using the medications and doing exercise. So I think everybody who can should be doing exercise, potentially doing the psychotherapy or the cognitive behavioral therapy. And then also, some of those other, stimulation and those type of things may be helpful too. So combining all these different things may help a little bit. And finally, address anything which could be making the pain worse. So if someone's, very depressed or have a lot of anxiety, generally they are going to have worse pain. So if you can treat those other symptoms, then the pain may get a little bit better. And we all need sleep. If we don't have sleep, then our pain is worse. We feel terrible the next day. So addressing that sleep may help decrease the pain as well. If someone has a very stressful home life or work life or money troubles, all those type of things, having that increased stress is going to make your pain worse. So kind of addressing that, if you can, may be a good way to go. So those are the kind of the major things that I wanted to cover.
So I have a interesting question for you. I've been paralyzed for 25 years, and I'm fortunate that I don't have severe neuropathic pain, but it comes and goes. And I find that if it gets started and I get distracted enough, the pain kind of subsides. Why does that happen?
I'm not quite sure exactly, but it's probably with any of these things, you're kind of decreasing the the stimulation to the brain. It's all our whole brain and the connections there. They're all nerves. So if we're kind of distracted in our thoughts or someone else, then we're not necessarily perceiving that pain at that particular time. But I don't know if we know exactly why necessarily that'll help. And certainly there's different things at different times which can worsen it. If someone has a urinary tract infection, it's very common that their nerve pain gets worse. Or if they have urinary, just like if someone has a urinary tract infection, their spasticity may get worse. So little things can kind of trigger it off to make things worse. So you just kind of have to figure out what works for you.
Yeah. So are there any other questions or comments for Dr. Bryce before we move on to our
There was something in the Q&A.
Ethan?
I would just love to know why our body or why we feel the pain from these cutoff areas and not pleasure. Why is it burning pain as opposed to tickling, or excruciating other pain as opposed to euphoria or uncontrollable orgasms? Why does it have to be pain?
Well, I think so in terms of, these are kind of like the sensations. So we have the pain sensation and the touch. So some people don't necessarily feel pain, but they may feel something different there, like a kind of like a warm feeling or different types of things. So it all kind of is related to, the kind of the sensations that you have. A lot in terms of like the like the orgasms and some of those others, they're kind of running through different parts of the nervous system. A lot of that has to do with like kind of the autonomic nervous system and those type of things in terms of, the neurological connections.
Dr. Bryce, do you know anything about the drugs being developed from spider venom? Someone asked.
There are some, neurotoxins that have been developed, and there's, for example, one that's been around for a number of years that is only used, like in the injected kind of right around the area of the spine. It's implanted through like a pump that people have for like baclofen. They also can use this. There's actually a kind of a snail toxin called zoconotoxin, which can have there, but it has a lot of side effects and it can be pretty toxic. So it's not generally used a lot in terms of that. So that's the one.
I have a tarantula. So what you're saying is I shouldn't go in the room and have her bite me in my leg.
I'm not quite sure. The major thing. So with the neurotoxins, they're used a lot, like botulinum toxin is a neurotoxin, which kind of, addresses the kind of the nerves which go to the muscles, and they kind of, knock out those nerves which go to the muscles, and that's how we kind of treat spasticity. But it's obviously very hard to kind of target those particular the neurotoxin to the nerves that are causing the pain. So I think as we learn more about genetics and the genome and all that type of thing, which we are learning quite a bit, year after year, that perhaps sometime in the future we'll be able to kind of target more specifically those particular nerves, perhaps with like a neurotoxin or something like that there. But I don't think we're quite at that stage right yet.
We have 2 more questions, and I can answer the next one, but maybe you can clarify more on it. It says, does being outside in the cold weather make neuropathic pains worse? So, for some reason, it happens to be true. If you're out in the cold, it does make it worse, in my case anyway. So can you clarify a little more on that?
Yeah, I think, some people it makes it worse, some people it doesn't, just like same thing with kind of spasticity, the cold may make you have a lot more of the muscle spasm. Same thing with the nerve type pain. So why that is, I don't know exactly why, but that's certainly the case in many people.
And
I'm
then,
complete opposite. I am in so much pain in the summer, and in the winter time, my pain is so much less. And to alleviate my pain a lot of the time, I go take an ice cold shower.
And there's other people who have told me that, if it's like, they go visit Arizona, their nerve pain, is much less there, because there's much less humidity than in this area. So there's a lot of different things that can affect that we really don't know why, but it's certainly the case.
And we have one more question for Dr. Bryce. I've been taking Neurontin for many years, and I don't think it's doing any good anymore. Does one develop a resistance to this drug after a period of time?
I'm not sure if we necessarily, develop a resistance, but it may not be doing that. And, really the only way to kind of figure that out is, with your physician's guidance, kind of slowly stop it and see if it really makes any difference or not.
Cool, thank you very much. And Ethan, would you care to share your presentation? Thank you very much, Dr. Thomas. If anyone else has any other questions for Dr. Thomas, he'll be here. You can add it to the Q&A and we'll get to it at the end.
Thank you, Dr. Thomas. For Dr. Thomas, at one point was taking care of or helping me with my pain management. I've always found him to be incredibly packed full of information, all the current stuff, and it's always been very helpful. So personally, I would like to say thank you. And for anyone who is needing to consult with a pain doctor, Dr. Bryce, you would be in very capable hands under his care.
Absolutely.
Do you want me to do a little background? Do you want me to just jump right into the talk?
Do a little quick background and then, share your presentation and go into
Okay, we'll go from there. All right. My name is Ethan Ruby. I was injured in November of 2000. Just had my 20-year-old birthday. Was hit by a drunk driver while walking in a New York City crosswalk. I have had pain pretty much since the beginning. Well, good. We're gonna say I was able to get somebody to pick up the one. Sorry about that. I'm arranging childcare at the same time. Very soon after my injury, within the first 2 or 3 years, a friend of mine brought me some information about cannabis being used as a treatment in Israel for pain, for PTSD, and for some other conditions. And I was open to the idea. I had had exposure to cannabis like most people in college. So I actually preferred to sit around with friends smoking a joint than drinking a keg of beer, but that was just me personally. I think that made me open to considering this as a potential medication, which led me down an entire decade plus long search into the medicinal properties of the cannabis plant. I learned about the endocannabinoid system and everything involved. I moved myself and my family from New York to Colorado to have safe and legal access to the medicine. And there I learned about the business. Connecticut was the first state that had a truly medical structure around their program, third-party mandatory lab testing, very limited license, and a high degree of regulatory oversight. For me, that was that gave me confidence to start a business that was a legitimate business. I didn't want this to just be a facade, just a way to legally skirt the laws and sell pot. I really saw and learned about the medicinal properties, and I wanted to see it delivered in a safe and effective manner. One thing about Connecticut that was great is they had pharmacists are the ones at the dispensary dispensing the medications. So I saw one of the questions, it has about interference with morphine. I'll get to that in a little bit, but at least here in Connecticut, when you go in and you talk to them about what you're on and what you want to take and what your goals are, you're talking to a pharmacist that does have information about contraindications, information about other drug and potential either the contraindications or that they'll work together in an entourage effect capacity. I put together an investment team and a management team, and our team ultimately won a license in Connecticut. We had the highest scoring application of all the people that applied. And we have been, since 2014, dispensing safe, legal medical cannabis to over 40,000 patients in Connecticut. We are just a producer and processor. We do not do the dispensing side. So we grow the plant, we process the plant, we sell the plant in its flower form, and we also do extraction to make specific formulations. We don't bake cookies, we don't make brownies, we don't make gummy bears. We make pills that have very specific ratio of THC or CBD or a combination of THC and CBD, all the way from 5 to 10 milligrams, all the way up to 100 milligrams. So we're really trying to approach this as a true medicine. And the efficacy that we've gotten, I hear back from patients, has been amazing. I've been literally knocked out of my chair half a dozen times from patients hugging me, thanking me for making this medicine safe and available in Connecticut. So I'm honored to be able to do this. My injury certainly was a devastating impact on my life, but having something that has allowed me to make my life more than just about my life has really helped me survive over the last 20 years. And being able to be a voice for responsible use of cannabis has been a privilege. People listen to somebody in a wheelchair a little bit more, at least they're willing to listen to what they have to say. And I've been happy to use this pulpit to deliver the message, because I truly do believe that there's an amazing amount of medicinal properties in this plant, and we're just scratching the surface of the efficacy on a broad range of conditions. So I know today we'll be mostly talking about pain, but that's the short story of how I got here. Okay, I'm going to I'll launch into the presentation now. So understanding medical cannabis. Again, my name is Ethan. My company is TheraPlant. Our company sells only in the state of Connecticut. So to the extent that I do have an interest in a cannabis production business, I'll certainly make that aware. We do not sell any products in New York, and you would have to be a Connecticut resident in order to get products in Connecticut. There are programs in New York. There are dispensaries in New York. So you can register through your doctor, get a card, and go to a legal dispensary in New York to obtain cannabis. I believe it's only in extracted form at this point in time, not in flower form. To date, I'm not going to talk specifically about XYZ strain will treat this migraine or this form of pain. I have to be very careful about making those statements. Anything that I'm going to report here is more from anecdotal, from dispensary reports, from those pharmacists reporting back to me, from patients reporting back, and from hearing across the country about different patients trying different medications or different strains, different formulations, and different combinations. So what is our endocannabinoid system? This was the biggest eye-opening for me. I didn't even know we had an endocannabinoid system in our body. I knew we had a nervous system. I knew we had a sympathetic and parasympathetic and some other systems, but I had no idea about an endocannabinoid system. It is a complex physiological system that basically can help to regulate everything from things that deal with in our head to our body down to our toes. So from your head to your toes, that endocannabinoid system functions. It can affect your memory, digestion, immune system, inflammation. For our points here, the inflammation is probably most important, as different forms of THC, CBD, CBG, CBN have shown significant effects on inflammation. We do have endocannabinoid receptors all throughout our body. So to me, it was very interesting that we have these receptors in our body, and this plant has the most rich concentration of cannabinoids found in any other plant. So you can get cannabinoids from other plants. You can get other terpenes from other plants. Limonene, that's very present in cannabis, you can get from lemons or limes or any other citrus. And when it's extracted down, a limonene molecule from a orange looks the same as a limonene molecule from a cannabis plant. So we do have naturally occurring cannabinoids in our body that work with the receptors. Part of getting on a consistent regimen of different types of cannabis can help try to regulate this process. If there are deficiencies in some areas, this would certainly help to supplement them. And if there are overabundance in some areas, that would also be a way to show an indication of what the problem is and thereby going after solving that specific problem. This is just some more detailed information about the endocannabinoid system. I won't read through it. I'll make this presentation available if you want more information on the specific CB1, CB2 receptors and the more medical side. I think I'll try to keep it to a broader view of cannabis and leave the medical terminology stuff to Dr. Bryce. Again, endocannabinoid all throughout our body, located in almost every part of our system. CB1 receptors, CB2 receptors are the main ones. This is where the THC or the CBD will bind and causing the effect. Again, stepping back a little bit, THC is the psychoactive ingredient that you feel high from. in cannabis. CBD is non-psychoactive. It is therapeutic, but many people talk about the entourage effect, which we'll get to in a little bit. But the THC is the one that people talk about when they're talking about feeling high or feeling stoned or otherwise. Yes, last but not least, there are enzymes that help break down the endocannabinoid system. One thing I heard when Dr. Bryce was talking, absolutely sleep, stress, and eating contribute to pain, no matter how you want to solve it. So if you can get good sleep, that's going to help with your pain. If cannabis can help you get sleep, then maybe cannabis didn't deal with your pain, but cannabis helped you get sleep, but then did help with your pain. Same thing with stress, same thing with eating. Many people have reported the munchies when you eat. I know a lot of people that were going through chemotherapy relied on cannabis to give them those munchies so that they would actually, the feeling of hunger overrid the feeling of pain, so they could finally get food into their body. And as long as you're having a healthy diet, having that adequate amount of calories and the right amount of proteins, lipids, minerals, etc., fats, will help your body deal with pain as well. There are a lot of different cannabinoids. These are just some of the main ones that are found in the cannabis plant. Again, THC and THCA are the psychoactive ones. CBD and CBDA are the other ones that you're hearing about. You can actually buy CBD directly online these days. There are pet stores that sell them for your pets. So CBD is out there and available, I think even on Amazon at this point in time. CBN, CBG, and CBC are some lesser known ones, but the recent work with those specific ones has been incredibly promising, specifically in the area of inflammation. So I think within even the next 12 months, there'll be a lot more information coming out about CBG, CBN, and CBC. Terpenes. So terpenes are really responsible for whether you feel up and euphoric from using cannabis, or you feel kind of relaxed and sedated from using cannabis. Again, limonene, myrcene, pinene, very common, also found in other plants, natural in nature. Excuse me. THC is THC. It's when you combine it with these terpenes that you either then feel a psychoactive high effect or a more narcotic, relaxed, depressive effect. So it's actually these terpenes that control that feeling. Okay, so the entourage effect. People talk about, well, if I just take CBD, will I get the same benefit? There is, in my opinion, a benefit from taking CBD. I think it can be beneficial on a daily basis and also prophylactically to make sure that that endocannabinoid system is flowing correctly. But from what I'm hearing from pharmacists and from patients, the effects of combining even a small amount of THC with CBD has a greater effect than just taking CBD alone. There's a lot of talk of whether that is because of reducing the thickness of the cell membrane, so it helps with the bioabsorption. That may or may not be the case, but the scientific evidence of that is yet to be shown. So, is cannabis right for you? That is something that you would definitely need to speak with your doctor about. Ideally speak with a pharmacist. That's one of the things I like about Connecticut. You get to talk to a pharmacist if you're a potential patient. Any potential patient can contact the dispensary in your area in New York or New Jersey and talk to them. Tell them you're thinking about becoming a patient. You want to know more. These are your concerns, and they will take their time to answer your questions. And if they don't, there are 3 or 4 other ones that are close by that you can just call them. the information is out there. So ask the questions. Being in a wheelchair, we have other considerations to take into account. Lung function is a big one. If you are, T5 or above, T4 and above, you have a little bit reduced lung function. So smoking may not be the best solution for you to consume your cannabis. Vaporization would be a little healthier when it comes to inhaling something. The benefits of inhalation, whether it's smoke or vape, is that the feeling would be almost instantaneous. Taking a pill goes through a different part of your body and would have to be absorbed through the liver. So the feeling would be much different, and the onset time would be delayed at least 20 minutes, if not up to an hour. If you do decide to try oral, taking it, whether it's a pill or a gummy bear or a cookie, the most common rookie mistake is that you take a bite, you wait 20 minutes, it doesn't feel anything. You take another bite, you wait 20 minutes, you didn't feel anything. You eat the rest of the cookie, you still don't feel anything, so you eat another cookie. Now you start to feel the first one, and now you're in a world of problems because all you really needed was that first dose, and now you gave yourself 5x what you really needed. So start slow, start low, and go slow is my very, very strong advice when it comes to considering taking any form of the medication, whether you decide to smoke it or vape it. There are edibles, a number of different edibles or a number of different vaping options for people in severe pain. There are now wax concentrates that are at 90 to 98% pure THC. So that is a very, very heavy dose of cannabis. So that is the end of my presentation. I am more than happy to answer any questions. Perfect, thank you.
So there was one compound question from Bruno Santos. He says, I am, what is it? Intracal morphine and baclofen pump. He's also on 600 milligrams of morphine. Is it safe for me to use cannabis? Which type of cannabis would be best for chronic lower back pain?
So again, definitely talk to your doctor. Definitely talk to your the doctor recommending or putting you on the morphine. Morphine is a much more serious, heavy medication than cannabis. If you overdose on morphine, you're going to die. You would have to almost eat your body weight in cannabis to die. I love being in a business where there are no reported deaths from overdosing, and it's much safer. As far as an interaction, again, there are no scientific studies. What I'm telling you is reports from other patients and from my personal experience. I find that if you need to take a opiate-based medication, morphine, Oxycontin, Percocet, the patients have found that they need to take less if they are combining it with cannabis. So they're feeling the effects of, let's just say, 5 milligrams of Oxycontin as if they took 20 milligrams of Oxycontin if they combine that 5 with a small amount of cannabis.
There's actually a comment from Lori that says, thank you for having this discussion. I am a huge marijuana advocate, medical marijuana advocate. I have been able to cut my opioid use down by 75% and gabapentin by 50%. So exactly what you was talking about.
My disability is osteogenesis imperfecta. Sorry for my bird. So my bones break really easily, and I have a lot of joint and back and bone, and I'm always in pain. And I am a proud card holder, and we do only have oil out here. But I love it. And somebody else had asked a question, and I should have had it up before I said this. Okay, John, he said, oops, wait a minute, I'm sorry. He said, whenever I use cannabis, it always left me feeling heavy-minded and tired. Are there different types to make you feel better and not just tired? And I mean, I gave him my answer, but I'm going to give it to you. Ethan, but I have the same problem. I, for one, don't like being high. So it took me, like, I don't like that feeling of high and groggy and laughing like I'm a fool. And so I found my balance. So you can find yours.
Yeah, so a lot of people report the same thing, that it either don't want to feel the effect of being high, or it's too much and they don't want to, they're no longer functioning. So what I would say is start with CBD or just pure CBD, whether you're vaping it or consuming it orally, and then add in a small amount of THC. So, TheraPlant makes a product that's a 10-to-1 ratio of CBD to THC. So you're getting a lot of CBD to a very little amount of THC, and you can start there and then go up to maybe even a 1-to-1 balance of CBD to THC. If that's not enough, you can go up and just use more THC. In terms of strains to look for, if you're worried about the kind of couch lock effect of being overly sedated, that's going to come from the heavy indica strains. So there was another question as far as pain management. If you're in really, really bad pain, then I would steer you towards the indicas, because that is going to really help sedate you and have that more narcotic effect where you're relaxed. You really don't want to get out of bed. You just want to put on a movie and not move. If you don't want that effect, you still want to be able to move around and even maybe be more creative or still engaging, then I would steer towards the sativa based strains. Those strains are going to have more of a cerebral effect, less of a body effect, and will ideally give you less of that cloudy haze, and still have the effect that you're looking for in terms of pain relief. So sativa for daytime, indica for nighttime.
So we have a comment from actually two individuals, one from from Andrew, and one from Jack Leak something. It says, can Dr. Bryce comment generally on the view of medical practitioners regarding the use of cannabis? Has this now been accepted as a valid medical practice? And it's kind of the same as what is Dr. Bryce's opinion on medical marijuana or marijuana as pain management?
Well, as the cannabis has been regulated as not a kind of a medication that can be used, there's not been a lot of scientific study of it. I mean, there's been some of the extracts, there's been some small studies that have looked at that. So in terms of like the the scientific thing, there's not a tremendous amount of literature out there, these randomized controlled trials, saying that it's helpful for pain after spinal cord injury or spasticity or anything like that. So that's kind of where we are, but it's certainly kind of an evolving field, and as it becomes more available, I think it will kind of be studied more, and we'll see if it has an effect. But anecdotally, I will say that I had people say that it helps. It sometimes helps, and it can decrease the need for opioids and all that type of thing. So, and I don't prescribe it myself, but I'm not opposed to necessarily to people to trying that, because I would agree with Ethan that it's better to be on that than to be on the opioids, given the risk of death and other bad things that can happen with that. And I will second the point that as a physician, I can't recommend smoking to anyone, especially someone who has this a spinal cord injury. And in vaping is as we get more experience with it, is not necessarily a benign thing either. So some the different type of administration, if someone's going to try it, would probably be my counsel.
So this would be maybe a question for both of you guys. From Danny, it says, I'm a C4, C5 incomplete and was wondering what can be done about the constant tingling. So maybe you want to touch on that, Dr. Bryce. I guess that's some kind of neuropathic
Yeah,
thing.
I think the whether or not someone has like the tingling or the numbness, and it's very annoying and there all the time, but they wouldn't necessarily say it's pain. I think there's, probably it's the kind of the same mechanism that's happening, with the abnormal firing of that. So, the same types of treatment that you would, use for pain, nerve pain, we would, potentially address, these other, abnormal neurological symptoms that are bothersome.
And I want to comment, like I'm in one of those gray areas. I have tried the gabapentins, I tried the opioids, and I'm a really lightweight. I take aspirin and I'm laying down for 4 hours because I feel high. But and I found that nothing really helps me. I've been on a high dose of Neurontin, and I would take it, and the pain just continues, the burning sensation. I was like, all right, whatever, I'm just gonna stop this. And there was no before and after. And I have tried the cannabis, and I have found that it helps with spasms and other things, but the pain, it actually amplifies it. It does the opposite. I'm like, oh my God, my joints hurt. The burning sensation is, completely out of control now. And now I'm just high and I can't do anything. I'm like, oh, okay, I don't like this feeling. So I kind of in that middle ground, and I'm like, what do I do?
So, I think we know that this pain can be very difficult to treat. That's why in that large study of, tens of thousands of people, we see, interview people who've been injured 25 years, 8 out of 10 still have pain. It's not like we have a great choice. And all these medications, although they help, certain ones help some people, and the combination may help a little bit, and it may, decrease the pain some. There's no miracle solution for kind of, getting rid of the pain. So that's why we, try and do multiple different things to, see if we can decrease the intensity with the different medications, adding on the, the exercise, which is good, trying to treat, make sure that you're getting enough sleep, treating the anxiety, the depression as well, anything that can make it worse. Also, psychologically, how you kind of, approach that pain, and just kind of, work through it and not let it interfere with your life. You may still have the pain, but we don't want it to kind of interrupt, what you're doing with your life. So that's where sometimes the, the psychological treatments, the cognitive behavioral therapy and all that type of thing can help, decrease the pain interference, so to speak, with what you have. So.
I agree. This is one of the reasons why, if anyone has noticed, I'm always constantly moving, and anyone knows me, I'm always, twitching or doing something, because for some reason that tends to help, I guess, alleviate some of the issues that I have. I'll get back to a few more of the questions. One of the questions says, will CBD with a trace of THC help allocate muscle spasms, and will increase in THC work better with CBD? Sorry. So the increase in THC content work better with CBD. So, Ethan?
Right. That broke up. Could you just repeat the question?
Yep. It says, will CBD with a trace of THC help allocate muscle spasms, or will increase in THC content work better with CBD?
So I have heard that cannabis definitely helps with spasticity. Again, I would start with the CBD and slowly introduce the THC. The THC, especially if you're using the indica, is going to have more of a body sedation effect. So if the spasticity specifically is what you're looking for, you might need to start with those indica-based strains, adding it into the CBD products.
So the next one I think is okay. And he says, it seems to me that finding a treatment or treatment package that works well depends upon finding a doctor and a team that will listen well and spend enough time to adequately assess symptoms and to monitor progress. It also depends on experimental attitudes and patience with progress. Given how medicine is generally practiced, how can we maximize our chance to obtain this level of treatment? So either one.
You got to find a great doctor like Dr. Bryce that's willing to give the time and has the knowledge and experience. That's my answer.
She kind of answered her own question, you know. But yeah, Dr. Thomas, you would like to comment on that?
Yeah, I'm not sure I know the answer, but
The next one is, I have spina bifida. I'm on morphine and Oxycontin for years of back pain. Is there a better treatment plan for me? Tough one.
so, I think, as we talked about, you kind of, as that last question was, you have to have a thorough evaluation to kind of look out and see what can be determined as the source of the pain. And it probably requires, multiple different treatments there. So, you just got to start at the beginning.
Maria also asked a question in the chat a little bit earlier that her spasms had increased. She's noticed an increase in spasms in the past couple of weeks. I want to say weather, but I'm no professional. What do you
Maybe activity level, there could be many things, but Maria is actually one of our members and has attended many of Mount Sinai's events. Could there be any specific reason why her spasms are worse and maybe she should reach out to someone? Dr. Bryce?
Yeah, certainly if someone, if their nerve pain is suddenly worse or if their spasms are worse, there's usually a cause for it to be worse. It's not something that just kind of happens. So probably a good idea to have a medical evaluation.
And she also says, since my accident, I have a lot of pain in my breast. I am a T5 complete because of that. I have chronic nerve pain. I took all of those medications that the doctor said. Can she look at other ways or discuss other treatment options since she's taken all of the medication?
I think with any of these things, it always doesn't hurt to have another look at things if things aren't working.
Yep. So are there any other question? Or any comments? There we go. We have 2 more questions. Questions about gabapentin. I've been taking the same doses for years, and I don't think it's helping me much. Do you develop? We did that already. The resistance. Do you develop a resistance to a particular dosage after a while and need to increase your doses? Dr. Thomas?
So you don't necessarily, develop like kind of a resistance to it. Like for example, someone becomes accommodated to using opioids and needs a higher dose, but it may or may not be doing anything at the present time, and switching to a different medicine or changing the dose or having a reevaluation doesn't sound like an unreasonable thing.
So we're gonna answer one more question because we're over time. The last question is, seems like over the years my back pain has been getting worse rather than better. Will cannabis help the pain without getting high? Also seems like working out makes me feel worse. So Ethan?
I'm not unsure I understand the question.
So he says that his pain has been getting worse over the years. Will the cannabis help with his pain without getting high?
So again, if you take just CBD, you can start there. It will not get you high. Now, some people are very, very sensitive. Anytime, the slightest bit of caffeine makes them, stay awake for days. Some people are very sensitive to medications. My wife actually can take CBD and she will feel a little bit off. So it can happen that CBD can have an effect on your body that will make you feel not normal, So yet certainly start with the CBD. You can go upping with the THC, But if you're having consistent pain, what we're trying to do is regulate your endocannabinoid system. If you can get that regulated, hopefully the different forms of your pain will reduce. But if you're not sleeping, taking an indica at night will help you sleep, will help you stay asleep. Using a sativa during the day would help you eat, getting in the good calories. So if you're sleeping better and you're eating better, that alone is going to help whatever pain you're feeling. So maybe the cannabis specifically didn't make the pain go away, but it allowed your body to be in a more homeostasis place that now is able to deal with the pain better.
And I lied. One more question for Dr. Bryce, and I think it's an excellent question. It says, can Dr. Bryce explain again how the plasticity of the brain deals with constant pain impulses?
So after an injury, so what we mean by plastic is that the nerve connection, so it's not just one nerve connecting to another nerve. There's a lot of different nerves kind of interacting there. And after an injury, some connections may drop out and other connections may form. So there's you can think about it as kind of like short circuiting almost, where there's an injury. And what we see that if there's kind of this constant barrage of signals, coming from the injury, up to the brain, in the brain, like in the middle of the brain, the thalamus, if this is constantly receiving all the signals, it changes too. There's it changes the connections there. And then we can see that these nerves, even though they weren't damaged initially, by the injury in the spinal cord down in the chest, they have received all these abnormal signals. And so these nerves change too, and then they start firing off. So you have abnormal brain function and abnormal firing of those nerves in the brain. And and as this kind of stays longer and longer, it gets harder and harder to kind of change. So it's thought that, if we can control this early, when there's just the abnormal firing in the spinal cord before there's, these chronic changes in the brain, it may be easier to kind of get it under control. So oftentimes if someone has a new spinal cord injury, it would be very aggressive in trying to treat that nerve type pain by adding on, several medications. And oftentimes it will, calm down and not be a particular problem. However, we don't really know this, but let's say we ignored it and it just kind of continued, I suspect that later on, if we tried to treat that same pain, it would be much harder to control because the body has changed in response to that abnormal signal all that time.
I want to thank you guys extremely. This is extremely helpful for the chapter, for the people listening in. I want to thank you guys for attending. Ethan, it looks like you might want to reach out to the Connecticut chapter. They have put in their email in there. But again, thank you, Dr. Bryce. Thank you, Ethan. Any last words, Jessica?
No, I mean, I'm not dying. They're not my last words, but thank you guys. I really, really appreciate it. Thank you for being here. Thank you, Brandon, and everybody.
Thank you, and have a good day.
Bye-bye.
Happy holidays, everyone.
Yep, happy holidays.
Happy holidays. Bye.
You will.